Good morning. Time is 10 o'clock. I'm first warning meteorologist Vanessa Vinant, and today's a severe weather warning day. That means we are under the tornado watch and also the threat for severe weather as we head into the mid-morning hours in the next hour or so. So a tornado watch for Palm Beach County, including Jupiter down into Boca and out to west in Belle Glade, including our inland communities in Wellington and Loxahatchee. That means we may see a tornado or two across the area. Right now, first warning radar, I am tracking a couple high clouds out there and some rain already approaching Indiantown, even just south of Pahokee, tracking really quickly towards the north and northeast and into Palm City and Jupiter Farms very shortly. If that continues to hold, and heavy rains on the west coast of Florida, all that will be tracking towards the east about 35 to 40 miles per hour and arriving in the next hour or so across the Palm Beaches and producing those gusty winds over 35 to even 45 miles per hour and isolated severe winds, most likely up to 60 miles per hour after 12 o'clock in the afternoon near our coastal areas. All that rain will be moving off towards the east coast by 1 o'clock in the afternoon, so in the next couple of hours. So the threat for severe weather will be increasing for the next hour, then looking much better by 3 and 4 o'clock. We'll have another update for you in the next half hour.
Trust WPPF 25 First Warning Weather, #1 in severe weather coverage. This breaking update is brought to you by these sponsors.
And so, screening for mental health illness in young kids through teens, young adults, basically we see up to 21, 22. And then having that ability to have the resources to help the kids that need them. And so about 10 years now, I've worked with the Center for Child Counseling, and this past year I became the medical director because of that passion that I have to really try to make this work in primary care and be a model for other primary care centers.
What are you seeing out there involving kids and their mental health?
Well, before the pandemic, there was an epidemic, and then with the pandemic, it's 3 times an epidemic. So we're seeing a huge increase in mental health diagnoses. Our practice alone, we have 20,000 patients. Of those 20,000, 40% have a mental health diagnosis. So now again, we're a center that patients know they come to if they do have mental health needs because of the integrated care that we do have with the Center for Child Counseling. However, that's just really indicative of the community itself and how many kids are really struggling. 1 in 5 kids nationally have a mental health diagnosis, and we know that only about 20% of them actually get any type of care for it. So this is a critical need at this point, not just in Palm Beach County, but nationally.
Right, we know that there is a lot of support out there in the schools, but do you consider pediatricians the ones on the front lines of this?
We are. We're the boots on the ground, and I think it's hard because of what we do every day in the office. We can be quite busy with just that acute illness of fever, cough, congestion. However, we need to stop separating that out to be any different than the child who comes in who's anxious because they have a test the next day and they're throwing up because they're worried about that test. So really that complete child care is thinking about taking care of anything that is hurting the child. And the mental health can be as much of a struggle for them as an upper respiratory infection, right? So we have to consider that all the same. And it becomes a challenge with time because we only have so much time in the office. So learning how to develop the connection with the resources, and that's where the integrative approach comes in, where we have the Center for Child Counseling and other resources that we can plug the children into to get the help that they need.
What are the biggest challenges you face right now?
I think the challenge for all pediatricians is, first and foremost, they don't always know what's happening with their patients. Oftentimes we're left out of the conversation. The families, I don't think, necessarily think of their pediatrician as someone who can help navigate a mental health concern. And then when the pediatrician is included, again, it's challenging. There are barriers to care in that we're not really given the amount of time that we probably need to address it. Many don't feel comfortable with the education they've had. So again, to develop a community model where we work with other nonprofits to really help kind of support us where we have those holes in care.
We have about 30 seconds left. What are the solutions?
The solution is really that comprehensive care for integrating the resources locally as much as you can, and all of us working together, schools, mental health counselors, and pediatricians, to really attack the mental health crisis.
Dr. Fox-Levine, thank you so much for joining us here today. We appreciate your insight and all that information. Next, the resources now available when we go on the record.
Fargo is the new virtual assistant from Wells Fargo.
Oh, come on.
Fargo lets you do this.
Fargo, turn off my debit card. I found it. I found my card.
And also this.
Fargo, turn on my debit card.
Do you, Fargo? You can with Wells Fargo.
In Florida, hurricanes are a part of life. That's why over 100,000 Floridians have made StormSmart a part of theirs. Our Category 5 storm catcher screens, shutters, and high-impact windows are designed to help protect your home from hurricane winds, rain, and airborne debris. In fact, StormSmart can protect every opening in your home. If you live in Florida, extreme weather is a part of life, but for year-round storm protection, you can count on StormSmart. Call 866-60-SMART today for your free in-home consultation.
If you're looking for the yard of your dreams, look no further than Moon Valley Nurseries. America's largest box tree grower is now open in Riviera Beach. Here, you'll find a wide assortment of mature trees and hedges. Our courteous and knowledgeable team will assist you from planning to planting. Create a yard that ensures privacy and a place your family will love. Benefit from our stress-free white glove service and take advantage of our weather protection plans. From small projects to complete yard transformations, we've got what you're looking for. Come see us today.
It's halftime. Time to hit the bathroom.
Shower. It works. Got 2 more upstairs.
And the bedrooms.
I don't know what goes on in there.
And the living room.
It's the hangout house. That's why I'm moving.
And get an offer on your house. Selling your home to Open Door is so easy, you can do it during halftime. Sign up for a halftime showing at opendoor.com.
When you need a fighter, you need us. I'm John Morgan of Morgan & Morgan. Most insurance companies are big, really big. Imagine you're injured and now you have to fight for justice. Our results and reputation are well known to the other side. As America's largest injury firm, our Army will fight like hell for you. We have the resources to take on the biggest insurance companies in America. When you're fighting to get what you deserve, it's go big or go home. When you need a fighter, you need us. Morgan & Morgan, America's largest injury law firm.
Fargo, the new virtual assistant from Wells Fargo, gives you information you need quickly.
But if you don't have your account info for direct deposit, you all gotta come back tomorrow.
Fargo, what's my checking account routing number?
Be like her.
Do you, Fargo? You can with Wells Fargo.
You're watching On the Record on WPBF 25.
Joining me now is Renee Lehman, CEO of Center for Child Counseling, here to discuss the resources available in Palm Beach County. Thank you so much for being here.
Thank you for having me.
Renee, if you will, please talk to me about your role at the center.
As CEO, I oversee really what our programs, how we're implementing them, moving our vision and mission forward in Palm Beach County.
What is your vision?
We are building the capacity of our community to address the mental health crisis that our youth are facing. So not only through the treatment services that we provide, but prevention and early intervention. We know that we can prevent lifelong suffering that comes from having a mental health diagnosis often. So we provide an array of services within pediatric offices. You just heard Dr. Fox-Levine talk about our pediatric integration project. We're within the primary care setting, we're within the school setting, we're within the child care setting, really integrated into the community where the children are, so we can increase immediate access to care for children that may be at risk for a mental health diagnosis, because we don't have to wait for a child to fall apart emotionally before we do something about it. So beginning in utero through our infant mental health program with pregnant women all the way to age 18, and then building the capacity of their adult caregivers, whether it's a teacher in the classroom, a foster parent, or another caregiver to support their mental health and resilience.
What exactly are you seeing with regards to children and teenagers and their mental health in Palm Beach County?
Even before the pandemic, there was a youth mental health crisis. Coming out of the pandemic, we've seen referrals triple. At one point, we had 1,000 kids on our wait list. So we simply do not have the capacity within Palm Beach County to meet the need. So when I talk about the prevention, early intervention, we have shifted our whole model as an organization to support parents and caregivers. You know, innovative strategies like partnering with Palm Beach Pediatrics. How can we really combine the physical health with the mental health? Every time a child goes to their pediatrician, there should be that mental health check. And that's not really happening with every pediatrician's office.
So what are parents to do?
Well, ask the pediatrician, right? Are they doing a mental health survey? Do they know? You know, are they doing that check-in? We see most kids are going to a pediatrician. Most kids are not going to a mental health provider like us for a mental health wellness check, or just reaching out to a resource like Mental Health America. They have online surveys. If you suspect something's going on with your child, do that check-in and talk about it with your child or your teen.
At the center, you have a specific way of integrating your services. Talk a little bit about that.
Right, so we integrate within the communities that we serve. So being on site, we know that just coming through our outpatient program, for example, we have so many parents, so many referrals from the different systems. Having 1,000 kids on the wait list is very stressful. But if we're on site at a school and immediately able to service those kids that are at the schools and going into the classroom, teaching kids self-regulation skills, teaching the teachers how to support children's mental health, then all of the children in the school are building their capacity to self-regulate, look at their wellness, promote resilience. So that's the favorite part, my favorite part of what we do is actually being on site and doing that work within the community.
And that's one of the ways that you're active in the community is by visiting schools. Anything else you're doing to reach the children out there who may not have access?
Right, so we do a lot of education and awareness. We, through our website, centerforchildcounseling.org, we have lots of materials for parents, for caregivers. We have our Way of Being workshops and tip sheets. Through coming out of the pandemic, our education and prevention services team developed tips on really hard topics that parents may be struggling with. So based on what we were seeing parents call in about, we developed ways to talk to children about sexual abuse, divorce, war, school shootings. So these are really tough topics that parents don't always know how to talk about. And they were calling us, how do I help my child cope with this? How do I deal with this? We're going through a really bad divorce. What do I do? So being able to provide them with the tips and resources rather than, oh, you need to come in for an assessment, have a mental health diagnosis. No, have the parent really work with their child first.
What would you say is the best way for parents and caregivers to access your resources?
Well, they can reach out. They can go to our website. If they can't find what they need there, send us an email. We are tapped into not only what we do, but a whole network of nonprofits within Palm Beach County that are supporting children and families.
And we have your website right there up on the screen, the Center for Child Counseling. .com.
.org.
.org. Renee Laban, thank you so much for joining us and for sharing all this vital information. We appreciate everything you do for the community.
Thank you for having me.
Well, coming up on The Record, we talk to a local family about their personal experience.
Florida Highway Patrol has just notified us Trooper Zachary Fink has died.
We're looking at about a 14-mile southbound closure.
We have crews all over the Treasure Coast.
Heartbreaking news of a trooper who has lost his life.
We're hoping that they can kind of piece together what exactly happened this morning.
It's a very sad and difficult day in the state of Florida.
For continuing coverage on this tragic story, stay with WPBF 25 News.
after a car accident, do you know why money matters?
Ask the store clerk who got $650,000 after an accident injured his leg.
And ask the motorcyclist who got $11.1 million after nearly losing his life. Money matters.
800-561-1111.
WPBF 25 celebrates Black History Month.
You can achieve anything with good sleep, and over 1 million dreamers have trusted City Furniture to help. And from mattresses starting at $149 to a $300 gift card with Tempur-Pedic, you can rest assured we have the best price guaranteed, so everyone can live like this.
I'm Jerry. I smoked, and I have late-stage COPD. I'm hoping to get on the lung transplant list, but I don't know if I'll be accepted in time. My children are really worried. My tip is, every morning, give your kids a call or send them a text. It may be the last time that you do.
Tobacco Free Florida offers free nicotine replacement therapy to help start your quit journey. Call 1-877-YOU-CAN now.
I'm Jill Hazu.
And I'm Erin Burns.
We invite you to join us this Sunday for Total Retirement with Ernie Burns, where we'll discuss wealth management, estate planning, and more.
Ernie was named 2022's Forbes Best In-State Security Professional. You don't want to miss it.
Welcome back to Sunday with a Chance of Winning. Final question. Which one of these benefits can you receive every year if you enroll with HealthSun?
Is it $5,000 for comprehensive dental services? $2,400 for groceries, home and pet care supplies and utilities? $1,500 for OTC items, or all of the above?
Cindy?
D, all of them!
Call us today to learn more about our benefits.
$72,000 for John in Fort Lauderdale.
And $550,000 after Carla's accident in North Palm Beach. There's no question. You need money after an accident, and we want to help you get it. Money matters.
800-561-1111. And joining us now is Melissa Lavaglio and her daughter, Rose. Ladies, thank you so much for being here. Melissa, I would like for you to tell me a little bit about your family.
Okay, so we're a big family. We have 9 children. Age ranges from 26 to 6.
It's a big family.
Yeah.
And you're right in the middle, right, Rose?
Mm-hmm. And 6 of our kids have come to us through foster care adoption. And we've fostered around 27 kids in the last 9 years.
What are some of the struggles that your family has faced through the years?
With kids coming through the system, there's some mental health things that we deal with. Some of them are attachment disorder, dealing with trauma, separation, and acclimation to our family, and those types of things.
Rose, what has that experience been like with you?
It kind of messes with your mind a little bit because you're being pulled away from the only family that you've known. That it might not be the safest, but it's the only sort of family that you know, and it's functional in some sort. To be put in a family that does everything they're supposed to. They feed you, they care about you. They don't just walk away and like not speak to you or harm you in any way. They like genuinely care about how you're doing, what you want to do, who your friends are, what you love to do. They're just
there for you.
Yes.
And this was new to you.
It was.
Were you struggling with accepting that?
Yes, a lot.
Because you hadn't had that before.
Because you almost feel like you don't deserve it.
What are the resources that helped you cope with the changes that you were going through?
Definitely my therapist, her being able to come into my house and walking around my neighborhood, for just like even going outside in the backyard and getting fresh air, just her being there with me.
Being able to have some chat time.
Yeah.
And just talking your feelings out.
Mm-hmm.
That was very important to you.
Yeah.
Because had you not been able to talk to somebody, I mean, can you imagine like what that would have been like?
Definitely would have been 10 times harder than it is right now. Yeah.
And Mom, how do you feel about that, knowing what she was going through?
Yeah, I think that, paying attention, knowing when we need to reach out for resources, when we need to ask for help, it's beyond what we can manage at home, and having those resources for our kids is definitely important.
For families watching, what would be your best advice? You have so many children, you've experienced so many different things with each of them.
Yeah.
What would be your best advice?
To pay attention. For sure, pay attention. Some of the things that Rose probably wasn't used to is someone checking her phone and asking her questions and pressing when she really wasn't in the mood to tell me everything. But definitely paying attention to your children and knowing when something isn't right and asking for help, not thinking that you can manage it yourself.
And Rose, what did you learn from being able to speak with, your counselors or your therapists about communication? About being able, having to kind of share your feelings and talk to your mom about how you were feeling?
I think it was more of a, how to put this, speaking to people and telling, opening up and speaking about your feelings can sometimes be uncomfortable, especially for someone who has gone through the system multiple times and have been removed. So you don't really know how they're gonna react or just anything with them. So I guess you always have to be on guard, even though you don't have to. It's just a second nature.
Well, it was all new to you, so you weren't sure, what the reaction, right, trust, you weren't sure about the trust. Well, if I tell her how I feel, is that gonna change the way she feels about me?
Yeah.
And Mom, you had to, I guess, anticipate, and kind of be open-minded about what she was coming to you with.
Yeah, and having the therapist in our house is helpful because we can do kind of family time, so being able to get back together and talk about things or share things before or after a session, what's going on, and having Rose understand, or any of my children understand, that there's a trust there with the therapist, with us, with the family. It helps them to understand that they can share their feelings and they're safe.
Rose, what would you say to other teenagers in your situation who have been through the system and have had bad luck in other instances, but you have found a wonderful family and things have turned around for you? So what words of encouragement or advice would you give to some other kids out there who may be struggling?
Just to find someone that you feel safe with, and that you can tell things to, that they're not gonna go and just spread it around, that they're really gonna truly take it to heart and try to help you, or find somebody to help you. Just trust the people have a good heart.
How would you describe life now at home?
It's an adventure every day. Having a lot of kids in the house, it's fun. It can be loud, but overall, I wouldn't change it for the world. Yeah.
Melissa?
Yeah, same. There's a lot of chaos, but it's good. It's good working with kids is good.
Well, Melissa and Rose, I have to thank you both so much for opening up to us and sharing your personal story and your struggles with us. But I think other families who are watching and listening to this will certainly, some may be able to relate and others will certainly learn from it. So thank you both for sharing your stories.
Thank you.
And wish you so much luck. And I can tell by the smile on your face how happy you are. So thank you, Rose. And thank you for being here. We'll be right back.
It's not just about the adrenaline rush. It's about transforming lives.
Oh my God, she got it!
I'm on a mission to help people rediscover themselves. Finding Adventure, a new season, stream for free only on Very Local.
Why choose a Sleep Number smart bed? Because no two people sleep the same. Only Sleep Number smart beds let you each choose your individual firmness and comfort, your Sleep Number settings. It's so smart, it actively cools and warms up to 13 degrees on either side for your ideal sleep temperature, and effortlessly responds to both of you for your best sleep night after night. Now, save 50% on the Sleep Number limited edition smart bed, plus 0% interest for 36 months on select smart beds. Ends Monday. Shop for a limited time and sleep next level, only at Sleep Number.
Look at this. A Medicare plan with a prepaid card for healthy groceries and other expenses.
Is that from Aetna?
Yeah. Why?
I have an Aetna Medicare plan. I get a prepaid card with a monthly allowance I can use on groceries, utilities, even rent.
Really?
Yep. You should give them a call.
I guess it can't hurt to call.
Never hurts to call.
If you're eligible for Medicare and Medicaid, call us at 1-877-38-AETNA. We'll explain benefits you may be eligible for. Our dual eligible special needs plan offers no limit on covered dental services, $0 copays on covered Part D prescriptions, plus a monthly allowance for groceries, OTC, and utilities.
So I can get all of these benefits on top of what I already get?
That's right. You keep your Medicaid benefits and get even more from Aetna Medicare.
Wow.
Let me walk you through the plan. Make sure your doctor and prescriptions are covered and talk about the local support you'll get.
Call 1-877-38-AETNA today and let's make healthier happen together.
So, did it hurt to call?
No, not at all.
What's my Safe Flight story? I'm a photographer, and when I'm driving, I see inspiration right through my glass. So when my windshield cracked, it had to be fixed right. I scheduled with Safe Flight Auto Glass. Their experts replaced my windshield and recalibrated my car's advanced safety system. Safe Flight is the one I trust. They focus on safety, so I can focus on this view.
Safe Flight Repair, Safe Flight Replace.
With the Freestyle Libre 3 system, know your glucose levels. No finger sticks needed. All with the world's smallest and thinnest sensor. Manage your diabetes with more confidence and lower your A1C. Try it for free at freestylelibre.us.
Southern weather is extreme, and strong windows are critical for your safety and comfort. Your New South windows are custom built specifically to take on southern weather. We install superior windows and peace of mind with our lifetime guarantee. This is real factory direct. No middlemen, no surprises. Be New South proud.
Buy more, save more. Volume discounts on 4 or more windows.
All law firms are not the same. Morgan & Morgan, for the people.
Thank you for making us part of your morning. As always, we encourage you to be part of our discussion each and every Sunday right here at 10 a.m. Until then, you can watch this morning's On the Record and every episode on our website, WPBF.com, and on our free WPBF 25 News app.